All week long, we're highlighting women's health, and today we're focusing on the mind. The mental health crisis can affect women completely differently than men in many cases. And this morning, we are joined by Dr. Dana LaPlata-Oghini, a clinical assistant professor at the University of Michigan. Thank you so much for being with us this morning.
Thank you for having me.
Let's start off talking about really what women are grappling with in many cases right now. The pandemic impacting obviously everybody, but for women, there's often social isolation, juggling work and childcare. Women are also more likely to be involved in caring for their older parents. So what's the mental toll of dealing with all of this? And what advice do you have for somebody trying to balance it all in the middle of this crisis?
Yeah, I mean, I agree. This pandemic definitely just adds a whole nother layer to the stress that many women may already have been dealing with, right? That's just a really stressful time, like you already highlighted. Families have lost income. Sometimes there's a lack of childcare, like you already said. And look, many essential workers continue to face a number of challenges, including a greater risk of contracting the virus. So I think in general, it's just really important to highlight that it's a stressful time and it's okay, and to reassure ourselves. So, what I think about in the middle of all of this is the three R's: reassure, routines, and regulate. So, it's okay for us to just reassure ourselves that, look, this is a hard time and it's okay, and that we've gotten through hard times before. Being mindful about our daily routines and what we're doing to take care of ourselves, including diet, exercise, a healthy, balanced diet, exercise, and sleep. And then figuring out how you regulate yourself and your emotions. Like, what works for you? Those are some quick tips that I could think about right now.
Yeah, and what works for you may not work for other people. So you kind of do have to know yourself. Good advice there. So women are diagnosed with depression and anxiety more often than men. Why is that?
Yeah, that is true. Depression and anxiety are more common in women. There are several reasons out there, probably way too many to dig too deep during our short time together, but clearly, clearly biological differences, right? So, you know, there are hormonal differences between men and women, also psychological differences, and some sociocultural differences as well that may play a role. So, researchers have found that gender differences in socialization could be playing a role there. In general, girls, are socialized to be a bit more nurturing and sensitive to the opinions of others. And look, we already highlighted it, right? Women, we're often wearing many, many hats.
Mm.
And just trying to find that balance is really important.
I mean, and when we showed that graphic there, 12 million women a year can be
Yes.
diagnosed with clinical depression. Those numbers are staggering. So what are indicators that a woman might need to ask for some professional help?
That's an excellent question. I think it's really important to highlight a few things. So, if you're feeling really sad or down for a significant period of time, more than 2 weeks, if you're getting too much sleep or too little sleep, if you notice a change in energy, either it's too low or you're feeling really restless, changes in appetite or significant weight loss or weight gain, um, excessive feelings of guilt or hopelessness, and excessive use of alcohol or drugs. Those are things to highlight. But I think the biggest thing to highlight is impairment. So if you notice that you're not functioning at the level you should be, then we have to seek out help and get you to, the right level of functioning for you.
And it is absolutely fine to ask for help. It is a good thing to do. Dr. Dana LaPlata-Oghini, thank you so much for joining us this morning and sharing your expertise on this very important topic.
Thank you.